Simranjeet Kaur with a floral gesture. Now, I would request our head of department to introduce our speaker of today's session. A very good morning to all of you. Worthy Vice Chancellor, sir, Honorable Registrar, sir, respected principals, deans, head of the departments, I extend a warm welcome to all of you here. I find this as an immense pleasure to welcome and introduce our Honorable Speaker of the Day, Dr. Simranjeet Kaur. She has been a great personality in the field of physiotherapy. She is working selflessly for physiotherapy profession. Madam has specialized in the field of cardiopulmonary. Not only this, Dr. Simranjeet Kaur has done various additional courses like craniovascular osteopathy from Australia, art of manipulation, functional manipulation therapy, sports rehabilitation from America. She has been a pilot's instructor from Ireland. She is taping therapist, CKPT, CDNT, dry needling, that is level 1, 2, 3, and abdominal. She has a specialization in acupressure, cupping therapist, yoga, basic life skill specialist, digestion exercise trainer as well. She has a specialization in strengthening and conditioning instructor, pelvic floor trainer. Then she specializes in Gosha therapy as well. She has a very special techniques of Mulligan, Maitland for spinal mobilization. Madam has treated many renowned football players, cricketers, martial art players, golf players, and Bollywood stars as well. She has been official physiotherapist for Round Class Football Club 2019, official physio for Mr. India and Miss India competition 2020, official trainer for pilots at Academy of Health and Exercise 2019. Dear viewers and the audience sitting over here, movement is very essential for human body and it holds the utmost importance for survival and growth. But when that movement becomes cranky and when the movement is not appropriate, the survival becomes tough. And keeping in view the more involvement of all of us in the gadgets these days due to COVID pandemic, we decided as a physiotherapist that we should do a session on posture care because your skeletal problem starts from your posture. So not taking much time, I would like to invite our speaker of the day to please start the session and please let us know about the good posture. Thank you so much.
Hello everyone. Thank you so much for inviting me over here, and I'm in gratitude to share my knowledge with you all. And I think that yes, it's the need of the hour. The posture is really, really very important, and I want you all to follow good postures, especially after seeing this webinar. So today I will start up with what is posture. So how we all are sitting is a posture. It may be good or bad. How we are walking, how we are sitting, how we are traveling, we are always following a unique pattern and position of our body parts. That is combination is called posture. Okay, with the definition if we go, the posture refers to the position in which someone holds their body when standing or sitting or lying. So everyone today, just have a look on your own self, how we are sitting. Are are our legs are crossed or are we sitting with the open legs? Look at our shoulders. Is it up and down or is equal? Okay. If anybody is sitting with legs crossed, only sitting at your will determine which muscle is weak and which muscle is tight. Okay. If our right leg is always going on our left leg, that means the right adductor muscles are weak. That a physiotherapist can tell just looking at you. Okay. And if your shoulders are going up and down, the one which is up, that trapezius muscle over here is tight, is shortened in length. Just looking at you only, a physio can tell that. It doesn't need any MRI or X-rays. Okay. And secondly, people today these days are just relying too much on X-rays. बिना X-ray के orthopedician बात नहीं करता है. Why that is happening? When many of the things are being under clarity with this, X-rays were basically meant just to tell that to confirm the diagnosis. The diagnosis is there with the physicians. So posture holds a lot importance. Okay, so we move next. How these postures were developed. When a child is born, the spine is C-shaped spine. And the initial postures the child is having is his thoracic spine and the hip mobility is when he is born. The secondary postures are with time which develops, like when we start holding our neck, we take our neck up, then our cervical spine develops, and with the movement on the standing positions, our lumbar spine develops better. So these two, the cervical and the lumbar, are basically meant for stability, and thoracic and hip joint is basically meant for mobility. And when we are into the sitting job, the reverse happens. Okay, the joints which were for stability, we are making them more mobile, and the ones which were for mobility, we are making them more stable. We are not using them. That is why I will tell you some of the exercises to reschedule your things so that it goes in the right direction. We'll come on it a little later. Now, as we see, there are spine. Okay, there are cervical, thoracic, lumbar, and sacrum, pelvic joint. These all combine. The combination of movements are there. Can we have a model? I'll just demonstrate that. Over here, beside me, you see, this is cervical spine. This is thoracic spine. This one is cervical spine. This is thoracic spine. Cervical spine and the lumbar spine are for stability. Thoracic spine and the hip joint is basically for mobility. In our body, there is one is for stability, one is for mobility, one is for stability, then for mobility. Okay, this kind of thing is made by nature. So when we are in sitting job, what happens is our neck bending is too much. The one which was for stability is going into the mobility, and this mobility joint is stuck. It's not moving at all. That is why the workload on the neighboring joints increases, and we generally accompany cervical pain patients and the back pain patients, which are most common these days. Everyone is having this one or the other day if we are not taking proper care of our posture. So, our main goal for the exercise therapy treatments is to make this joint mobile. Once the thoracic spine gains the mobility, the overload on the cervical and the lumbar reduces. Okay, so, the basic exercise for thoracic mobility which can be done is cross your hands. This can be done in sitting as well. She is moving the thoracic
thoracic spine. If you see the first range, it will be little less. Okay. And again, if you do it, second time the range increases. Third time the range increases more. Okay. So our capability is there that this hands can go beyond this center. Can you see the range gain? Each time the range gains. And once the range gain is there at the thoracic spine, the workload of the cervical spine reduces and the neck pain as well. So we need to check. And to monitor the posture, we have to examine the patients from three views, especially in the front view, from the side view, from the back view. And if we see this front view, if you see over here, are the shoulders in equal length or it's not? Just have a look. If we see the left shoulder is little bit higher than the right. Many of the patients only tell us that whenever I go for a photograph, my one shoulder is up, one is down. Whenever I go for a photograph, my neck is always tilted to one side. Isn't it? That only defines the degree of the wrong postures. If you see over here, this is up because of the tightness of this muscle. This muscle is shortened, this muscle is lengthened. But if we go for X-ray, it will say that right cervical spine or C2 dysfunction, this collapse on the right side. But in my view, if a person is going on the right, he is not normal. The length is elongated on this side and shortened on this side. So we need to treat it accordingly. Many times we go for the exercises, same on the left, same on the right. In gyms we see same on the left, same on the right. But our need is different. If this shoulder is up, that shows this muscle is tight, so we need to go for stretching of this muscle. This is the stretch of this muscle. Okay. This is shortened, so we are going for stretching of one side. And this is other side is lengthened, so we will not go for stretching, but we go for strengthening because it is under weakness. So strengthening would be we can do shoulder shrug on one side. Take your shoulder up, take your shoulder up, and once she is taking it up, can you feel the pressure here? So one side needs strengthening, one side needs stretching. So we need to monitor the posture. Accordingly, we have to design a treatment plan. And then we can gain the results very fast. In my clinic, I have been acquainted with the patients we are treating, and the results are there that on the day one itself, the patients are being recovered. I'll show you the video at once. So this was about the spine. All of us have been sitting in the wrong postures. These you can see. Okay. So after this, we go for the good postures. What is a good posture? We can say a posture to be good by the one which is having less effort. If we are sitting straight and our effort is reduced, then only it is a good posture. कई बार हम जबरदस्ती बैठ जाते हैं सीधा. We are under pressure and we sit straight, but our muscles are not allowing us to sit straight. Okay, whenever we are sitting straight, we are feeling like it's a 10 kg weight on my neck. It happens. Why? Because our muscles are not in proper length. Our one muscle is shortened, one muscle is lengthened. It is under the imbalance which is not allowing us to sit straight. And once it is not allowing us to sit straight, it will give you kind of a weight. Whenever our spine shifts even 1 inch up and down, it's like 10 pounds of weight increased on our neck. When it is more, you will feel that I'm really carrying some heavy weight, so I cannot sit straight. Many times I cannot sit with the legs apart. I have to take my one leg on the left, like right leg I'm putting on the left leg, for example.
why I am putting my right leg on the left leg? Why cannot I sit straight with the distance between the two knees? Have you seen? Many of us cannot sit straight because our muscles are in the shortened position. We need to do some stretching exercise to gain the length. Only then we'll be able to sit straight. And if we are sitting straight, it will give us less strain, less fatigue, less pains. Muscles will be relaxed. There will be more circulation. We'll be having a symmetrical body. Same length on the left, same length on the right. Whenever I'm going for a photograph, it will always be equal left and equal right. But these days, especially in the COVID days, all postures have been altered. The photographs really define that. So if we go follow the good postures, we'll prevent the arthritis and we'll increase our functional lifespan. So today we'll be discussing a few positions. The first one is standing. In the standing position, if you see over here, the person is standing with the abdominal belly coming out. Okay. Although he is not that fat, but we are standing sometimes in this posture. So it is a wrong posture. We need to stand straight, and if the standing time is too much, then we need to take some or the other stool, kind of short stool in front of us, so that we can shift our weight first on the right leg, then on the left leg, like that. But do not stand with your belly out. If you are in the habit of standing with the belly out, it will give you more kyphosis. Kyphosis is the hump back. Okay, you have seen this area popping up of many patients, many persons nearby. Okay, but till the time it is not really blocking or giving you harsh pain, we do not visit a physiotherapist. But actually, in my view, every one of us should go to a physio for a gentle body checkup. It's like a body service. If you go for a car service, why can't you go for a body service? You have to get your body checked up, which muscle is tight, which muscle is long, and accordingly just go for the exercises which are for you, specially for you, not the common ones which everyone is following. Then if we see to the knees, in the knees you can see there are knock knees. The first picture over here, this one, can you see this picture? In this, it is a knock knee. Okay, and over here it is a normal knee, and this is called the Barham, okay, Genu Barham. This picture is having open legs. This is mainly seen in the old ages, and this one is generally seen in the girls. Girls have a habit to sit the legs are very close to each other, so they develop this kind of knee. And if in old age, sometimes there is an inflammation at the knee and it develops this kind of posture. It's not. Excuse me. I'll just tell you about the posture till the time. See, the female clients especially have been sitting very close, walking all the time like this, wearing the heels that makes them develop this kind of posture. This is knock knee posture. Okay, and if the person is walking normally, he is having the normal distance. But with the age, sometimes what happens is there are inflammations at the inner side of the knee, and sometimes inner side of the leg, all the leg muscles get shortened. So inner muscles are short, outer muscles are long. The disbalance of these muscles will make you sit in the position like this, crossed position. Okay, you cannot sit like this. You have to cross your legs. So that will also develop the postures, wrong postures. But if you are not able to sit, if you go for a proper physiotherapy at the same time and elongate your muscles with the stretching exercise, then in the sitting in a normal position is really easy for you. And once it is an easy thing for you, then you can follow a good posture. Sometimes it's not in your hands. You have to go for a exercise therapy according to you. And if the inflammation is there on the inner side of the thigh, the like osteoarthritis is commonly there after the age of 40. People are developing this. Then their legs go into this direction, and that is the position. Can you see on the screen? That is
wrong positioning of the knee. That is also a reason that we cannot follow the good postures. So we need to go for the proper exercises to make them normalize. Only then the good postures are possible. If you are not able to sit straight for a longer duration, you need to go for a health checkup.
After this, if we go for the sitting positions, how to sit is important. If we sit properly, then only our neck bending will not be there. I told you in the starting that neck bending is really the reason that your neck is going towards the mobility and the thoracic spine is going towards the stability. The opposite is happening, which opposite from the normal. In normal position, your thoracic mobility should be more. Thoracic mobility is this area, the upper back should move. But if the person is sitting like this, in the first picture, if you can see the neck is so bent. It's in the bending position. Neck is going into the bending position, and the front half of the body is going into the curvature. Whenever you are observing any old age person, he is always stooping forward. Have you seen? Everybody is going into the forward stoop, and the old ladies are coming to me sometimes and saying that I am stooping forward, but I am having no pain. So is it normal? Please tell me. It's not. Okay. Why it's not normal? Because whenever a person is stooping forward, our body is either giving us pain to tell us that it's wrong, or it is giving us deformity to tell us it is wrong. Okay. Whenever you are having neck pains and we are ignoring our neck pains, then we develop a hump back. Okay. Because our body has to carry on. It doesn't stop until the end. If we are not taking care of our body will take care for us. It will reduce the pain, but it will develop some deformity. To prevent that deformity also, we need to sit straight. And if we are not able to sit straight for a longer duration, you need to visit a physiotherapist. Only a physiotherapist can guide you how to sit, which muscle is the problematic area, why you cannot sit. And determine a exercise plan according to you. As I told you in the starting, we have to stretch the tight muscles and strengthen the weak muscles. But in case if you are doing just seeing it here and there and doing anything, it will not work. And then we'll say that we are doing exercise, but it's not working. Why? Yoga is good, but sometimes with yoga also your pain increases. The reason is that because the demand of the body is different and we are providing the opposite. So we are lacking the need of the body. And the upper cross syndrome is really common with the sitting jaw people, in which the deep neck flexors become weak and this rhomboid area, the upper back area becomes weak, and the neck area, the back of the neck, this trapezius, upper trapezius muscles get tightened up and this chest muscle get tightened up. This is the reason for a humpback person. So accordingly, we have to give the exercise plan to make the person into the normal position, and so following that normal position will make the good posture easy for you. Okay, it's not that that child is going into the humpback and the reason is all defined. Like a person is having humpback, it develops steadily. Initially, you can control it. How? By following good postures. What is good posture? This is the good posture. How to sit? You have to take care. Just take care that you need to get for yourself an armrest. If we provide our body an armrest, a back supportive chair, and a footrest, these three things in the desk job exercise, in the desk job, will reduce the dysfunctioning of the body. You have seen any sitting job people having indigestion? Why the indigestion happens? Indigestion is also because of sitting job. Many of the sitting job people are having indigestion because they are bending, stooping forward. They are not taking care, so that even if I have seen many sitting job people, I have given many lectures in the IT companies as well. Over there, I have examined that they breathe with their abdomen, not with the lungs. And from childhood, we are being trained, lungs are meant for breathing, lungs are meant for breathing. But their lungs are actually not moving, they are breathing with the abdomen. If they are breathing with the abdomen, the lungs are not functioning and lungs are not doing their own work. and the work is done by the digestive muscles. And digestive muscles cannot do the function of their own, so indigestion happens. That is the reason you need to take care of your posture while sitting as well. Okay, and even the humpback, to prevent the humpback, the elbow support is really important. If you see our trapezius muscle, this neck, upper neck is painful for everyone. Uh, just have a look at here, everyone, to make you awake. Today, we all are seeing that our neck is paining. Everybody coming to me, our neck pain, ma'am, neck pain, what should I do? Why are neck pains? Why only this muscles get shortened? Because our full arm, this whole arm weight is being held. This is the muscle which is holding the arm. And if you all are told to work 365 days a week, a year with no Sundays, can you work? You will resign, isn't it? So this muscle also resigns. I cannot hold the body weight of the full arm all the time. So how can this muscle rejuvenate itself? It's only by two means. Either you go for a resting position on the bed, but we cannot rest for full time. Okay. So what we can do is just provide this muscle rest by providing it an arm rest. You all have arm rest over here in the chairs. It's a very good chairs. Just if you're putting the weight on the arm rest. Just put all of you, put the weight on the arm rest. Every one of you, please put the weight on the armrest. Are you feeling comfortable after using the armrest? Tell me. When you put the weight on the armrest and as compared to holding the arm, it will be better. Why it will be better? Because the upper trapezius work reduces, and many of us have upper trapezitis, we say, or the upper neck dysfunction, we say, humpback. In all those conditions, this muscle is shortened up, and to relax that muscle, to give the 365-day holiday of Sunday, you need to give it an arm rest. Okay, so if you go for an arm rest, and secondly, with the strengthening of the desired muscles, we can prevent this back and the neck pains. Okay, next we go for the correct driving positions. Each day we all are driving these days. Use a back support or a lumbar roll. Lumbar roll is basically you can roll a towel in the form of your arm and you can put it under the back side of your lower back. And your knees should be at the same level. I'll show you the picture that will be making this more clear. Seat should be close to you. Just have a look at this picture. In this picture, you can see the angle over here. The angulation is too much. That will give the back pain. And if angulation is nearly 90 degree nearby to it, or if your knee, this angle should be 120 degree, the knee and thigh angle. And the correct position is like your steering should be close to you, and you should be sitting straight. You can have the back support. And your arms should be 120 degree angle and close to your body. If we are holding any weight very far to our body, people are holding, especially small babies, they are holding very far, making them jump up and down. That will give the back pains. But if we hold the baby or any object or any box which we are carrying close to our body, it will not give you any pains, and moreover, it will prevent you from having back pains. So postures are really important. Correct lifting techniques are there. How to lift up. I will show you a demonstration for this. Just if we are lifting up anything, suppose any object from down, just bend. If she is bending like this, it will give you a strain at the back. But to prevent the back strain, can you see by this, it will give you a strain. And how to prevent it when it's a heavy weight, you need to prevent the strain. The slight strain is also avoidable.
Then you are squatting down, sitting and then lifting it up, and with the back straight. Please squat down, sit down, sit down. Okay, and then take it up, lift it up, lift it up. Basically, it is to sit down and then get up like this with your back straight. Okay, if you are doing it with if you're doing it with the back straight, it will not give you strain. And you should not hold the weight. If it is a single kind of weight, you should not hold it like this. But holding the weight close to the body is important. Hugging the weight like this. If you are holding it like this, it will not give you pains. But if you are holding it like this, it will give you pains. It will give you disbalance. One side is going down, one side is going up. If weight is heavy, person is limping like this. And to prevent the limping, you need to hold it close to the body. This is how you should hold it. And if it is dividable weight, two things, then you should hold half left, half right, divided into parts. Okay?
This is a picture to demonstrate all this which I have told. To stand for a longer duration, then you can shift your weight on one side. You can go for the opposite side, squatting and lifting it close to the body, and just bend your knees a little bit so that your back is straight. If your knees are bent, your back is straight. Many times we have to sit on the bed for a long time to do our work or computer job or studying something. If we are bending our knees in the sitting only on the bed, if you are sitting and just keeping a pillow under the knees, your knees are bent, then your back will never bend. Okay, one thing has to bend to make you sit for long duration. If you bend your knees, it will give less strain to the spine because spinal bending is problematic. This is how you have to lift. This was demonstrated. I hope it's clear. Yes? Just respond back. Yeah, that's good. You have to divide the weight, how you have to carry. And while wearing the shoelaces, this is very common, we generally go into this position. You have to lift your foot to wear the shoes, not bend your back. Okay? Just sitting for the long duration. If you're sitting for the long duration, over here you can even add up a footrest if this angle is not 90 degrees. This angle, knee and this thigh angle should be 90 degrees to make you more means sitting with ease. So for that, you can even add a footrest over here, armrest over here, and then you can do your work for a longer duration peacefully without pains. This is how to carry a baby. Many people go into this wrong posture to carry a baby. Abdominals. That is why I say that after baby, everyone goes fat. Because we are not following the good posture. We are not carrying the baby properly. And if you make the habit from day one, then the baby is also comfortable into the good postures only. Because in that postures, the mother can carry the baby easily for a longer duration. These days, even that holding baby bags are also available. Okay, and even while giving breastfeeding, there are feeding pillows available. These all things one should use to make the body easy. And this was the thing I was telling. If your knees are bent, then your spine will not bend. If you're having a lot of back pain, this position will give you pain reduction. It will give you some easiness. But remember not to follow it for a longer duration because otherwise you might develop the knee bending positions as well. Knee bending deformities can happen. For short duration, this position is good. And whenever to get up from the bed, we should always get up by taking a side. Okay, I can demonstrate that. This is really important how to get up from the bed because this we all are doing daily. And if we are getting up straight, then it will give you a strain on your back. In this position, I have made even the paralytic patients get up. Okay? So paralytic can also get up in this position very easily. Person is lying. First of all, if the person is lying down straight, one should not use much pillows. Only then our neck is straight. Otherwise, neck will go into the bending positions. To make the neck relaxed, one should not use much pillows lying straight. Only then the neck is straight. If you are having a need that I have to get a pillow and I cannot lie down straight, that means you need to go for a physiotherapist. You have a hump back. Okay, but we are not going to the physiotherapist, just extending that period, that will lead to this prolapse then later on. To prevent that, whenever on the side, how to get up, I was telling about. Take a side turn, take a side turn. Whenever to get up, the legs should go down first. Go down first. Put the weight on the elbow. Put the weight on the elbow, elbow bending over there. And then get up. If the person is getting up always from the side, first the legs should go, then the body. But when we are lying down, elbow bending, going to the lying position, and now last is the legs coming up. This is how we have to get up from the bed and lie down straight. And whenever we are lying down straight, generally no pillow is required, but you can take a thin pillow if you really want it. Okay, and if you are in the sideline position, then you have to lie down with the pillow over here, go to the sideline, and another pillow should be there in between the legs. Is it comfortable to you? Remember, this pillow in between the legs is important. Why it is important? To make the distance between the two knees. Because otherwise the distance will reduce and will give a strain on the back. So there should be a distance between the legs, and whenever you are on the side, your pillow will support the neck so that you don't go into the neck bending position. So this position is really good for lying down, and if the lady is pregnant, it should be done on the left side. That will give more blood circulation to the baby and the nutrition, because it will give more circulation to the stomach. I hope you are all looking at it, enjoying it. Okay, how to poo. Now it is again easier if you have a footrest. If you are using a footrest, then it is easy. Indian seats were good. Okay, it has been proven. So how you can do, if a person is having a knee problem, he can make it easy by doing this. Because with this, your spine is straight and your pressure is more. You can easily do that. And about kneeling, if you go, this is the correct form of kneeling. Kneeling chairs are also available these days to make you sit for a longer duration with the easiness. This is on all fours. Then we go for the special positions. These are pregnancy postures. This I've already told you that if we go for the left side lying position, there is more blood circulation, more nutrition, more oxygenation to the baby. So, especially after the 3 months, the second trimester begins, then the lady should go into the sideline on the left more. But it doesn't mean that the right sideline is totally contraindicated, because all the positions are given by God. We need to do all those things, otherwise we'll develop one side shortness and one side length. So everything should be followed, but of course in pregnancy, prone lying is not given because it will pressurize on the baby. But left, right, everything should be changed, but more on the left. This is how the feeding pillows are available. I was talking about. Baby should be the lady should hold the baby close to the body so that it doesn't develop the neck pains and the back pains. Neck bendings are prohibited. Whenever to change the nappies, one should always go for a height table instead of doing it on the bed, which is very common. So if you go for the bed nappy changing on the height table, then your neck bendings are not there. So you will prevent the back pains and neck pains after pregnancy back pains. So poor posture leads to abnormality. To summarize this all, we can see this is really important slides. That is why I made it in dark color just to make you awake. Decreased oxygenation. If the posture is wrong, the oxygenation decreases. And to tell you about a live example, in my OPD, one patient was there who was waiting for 15 minutes and his turn didn't came. And he said that I'm really annoyed with you. I am not seen properly. I am not at the given time. He was in quite anger. And once I did the manipulation of the cervical spine and make it normalized, inflammation was reduced, pain was reduced. Suddenly the person said that I can wait for half an hour more, but I want a treatment from you only. So it was a live case. I was also amazed to see even the voice change was there. person was having a terrible anger initially, and after the treatment, he was so polite. How this politeness came? Because our spine, once it is straight, it will give you more oxygenation to the brain, and if the mood also is better, your fatigue is not there, increased that stress kind of thing is also reduced, because inflammation is reduced, pain is reduced, you are more straight, more tall, your memory, breathlessness, power, everything increases if you are in a good posture. Then decreased circulation occurs if the posture is not good. Decreased circulation, how? Because if the person is stooping forward. If the person is stooping, then there is once the anterior portion is getting shortened and back posterior portion is getting elongated, giving less by. I might show you. See, if the person is having a bad posture, like he's having a humpback or a forward bending, stooping posture, you can see my front body is bending, shortening is occurring, and my back body is elongated, too much elongated. With that low space, my organs of digestion are not able to move. My intestine is not able to move, my stomach is not able to move. I am totally compressing it. And secondly, the lungs are also not working properly in the wrong posture. That is also is the reason that oxygenation is reduced. Your indigestion is really common if you have a wrong posture. To prevent that, postural correction exercises are there. We should do that. Then abnormalities can come. Initially, the pain comes. If we don't take care of our body, then deformities comes like flat back, kyphosis, sway back, many others. Abnormalities of walking are there. Even balance loss is there. If you see anybody these days, a normal population also, if you take any one of us from here also, you stand on one leg, our foot shakes. Why that shaking is there? Because our core muscles are not that strong that we can hold on one leg. We cannot change our pants standing on one leg. We need to sit. We cannot bath standing. We need to sit down and then we can go for a bath. Why this is happening? Because our core muscles are getting weaker. Our balancing muscles are getting weaker. That is also a reason of wrong posture. See, if I move my hand in frozen shoulder cases, many of us have frozen shoulder because not only because of shoulder but because of our abdomen. We are having a sitting jaw, abdomen is not moving properly, and whenever we are moving, just everyone take your left hand up and keep your other hand on the abdomen. Again, keep your left hand up and other hand on the abdomen. Can you feel when you take your left hand up, your abdomen also moves. When you move your leg, just move your left leg up and other hand on the abdomen. If you move with one hand over here and then, okay, just move one hand on the abdomen and the other leg up. Take one leg up. You will feel that when you move your leg, your abdomen also moves. Okay, but if we go for only movement of the hand or only movement of the knee, means our abdomen is having a role in it. There are interchains are there. If we go for anatomy trains, that's a really good book to read. In that book, it is really demonstrated that our muscle shortening is also going under the chains. If person is having right neck pain, then it's really common that person is having right adductor tightness. Right side, every full right side is going into the weakness. Sometimes most common it is, but if the spiral chain is involved, then right and left. If person is having too much of complaints and we are getting confused, is for कौन सा exercise there? He's having neck pain, he's having back pain, he's having knee pain. What should I start from? I am confused what exercise I should give. Then it is the core which you need to strengthen up. Because in each of your movement, your core muscles are moving. But it's not necessary that when you only move your abdomen, you go for a deep breathing, move only abdomen, your hand doesn't move. Okay, so core muscles play a very important role. You need to strengthen them up for digestion, for balance gain, and next comes the speech disorders. I have also treated many ladies with speech disorder. I have videos as well on my channel, youtube.com/Dr. Simran. If you go for that, speech disturbances also we have treated. because that was also related with the wrong posture. If your neck postures are not correct, your sternocleidomastoid muscle, this neck muscle, gets shortened up. This will pull your zygomaticus bone, and sometimes TMJ locking is there. Person is not able to open the mouth, and this will also give speech disturbances. Voice box moves here and there on one side. It will the digestive muscle. This one will having one side will have some kind of swelling. If you treat all these kind of things, you can even reduce the speech abnormalities. So, with sitting on the wrong side might lead to so much of problems. Person might have vertigo. If he's always on the phone like this, one side neck compresses, one side it elongates. The inflammation comes first, then pain comes, then we don't take care of our body. Then sometimes our nerve get compressed and our brain is getting pulled up, which is the reason we are having eye strain, vertigo coming up. And even we have treated our infertility cases with correction of the posture, viscera correction, visceral osteopathy plays a good role into it. And even sensations get disturbed, like if you are having cervical spondylitis for a longer duration, you might develop numbness in the arms, numbness in the legs. So that can also be treated up with the good exercise protocol. So quality of life, this can be improved if you follow good postures, and to follow the good postures you need to go for few exercises daily. So what kind of exercises we need to go for? Okay, we need to see all of our body from head to toe. Just can we have a model? Few of the exercises we can follow all the time, sitting, even in the sitting job, we can do. These exercises will promote you all to prevent the bad postures and take care of your light disturbances which you all are having. The first one, we go for the upper neck stretches. Bend on one side, hold the ear, yes, pulling it, and this side, down. If you see over here, you have to look in front. Don't bend too much. That rotation of the head should not be there. That is the commonest mistake. One should look in front and then do it. With this, can you feel the stretch over here? This is the stretch for the neck muscles. This one should do every day. And how to know that which side should we should go for more and less? Our body tells. You will feel a stretch more where it is required more. Okay? And if you will feel a stretch less, that means it is not needed. Okay? This is a very easy way to do. Remember, because just do it on the opposite side. Can you feel this side more? Is it equal? Both sides equal? Which side was more? Okay. The side she is only demonstrating, telling us that the one side is more. The one side which is more, you have to do it for a longer duration or more number of repetitions. Anything which suits you. But do it with patience. If you hold it for 10 seconds, it will give you more results rather than if you're just putting on and off, on and off. Okay? If you are giving a hold of 5 to 10 seconds and doing it only one time also, it will give you result. But if you're doing on and off, it will only give you circulation, but it will not give you a proper stretch. Okay? So you need to hold for 10 seconds. This is a common stretch for the neck. And even neck circles one can do in sitting. Neck circles. If the person is doing neck circles, one should remember, do the neck circles. If one is doing neck circle, one should remember that it should be done with a slow speed. If you're doing with a slow speed, you'll always go in the right direction. If a mother is teaching a child in a slow manner, see A first, B first, then C, isn't it? One doesn't jump to Z on the day one. So do it on the slow. If you go on the slow pace, you will remember. Your body will remember. Anything which is told to you with a less speed is remembered for a longer duration, is giving output for a better result. Okay? It will give you strength. And if you are doing it very fast, people are doing in the yoga class, running like this, it will not give you strengthening, but it will, the jerky movement can create imbalance. Okay? But if you are doing slowly, the wrong thing also comes into the right place. So speed is really important. And secondly, you can add up breathing into it.
Half circle inhale, half circle exhale. Just look at me. Bending down, I'm feeling a stretch. Bending here, I'm feeling a stretch over here. Bending back, I'm feeling a stretch at the anterior side over here, like this. And half circle I'll do inhalation and half circle I'll do exhalation. Half circle inhale and half exhale. Just do it. Inhale, 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 inhale very slowly and then come to exhale, 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 exhale. And if in this circle I am feeling a stretch, especially the stretch is felt in the diagonal direction, can you feel the stretch? Over here I need to hold. If I feel the stretch, I have to hold. And then again going in the side, here towards the side, I can hold over here. Because stretch is coming on the side direction. If you're going in the back, you can hold over here. If you're going over here, you can hold. And this kind of way, if you're doing these circles, even 2 to 3 times also, it will give you results. It doesn't mean that you have to do for a longer duration of 30 minutes of one exercise. It doesn't mean that. Even going for 1 to 2 reps in the right way will give you results. But what happens, why we tell you 10 reps or 5 reps? Because we know that all the 5 you are not going to do correctly. Okay. Many times we are following wrong process. To prevent that, you just make sure that you are doing very slow. Every one of you just try a half circle. Just feel where you are having the stretch. While bending on the one side, can you feel the stretch? Just feel it slowly, slowly, slowly and come to the center. Even doing it one time will give you result if you are doing very slowly. Secondly, we come to the shoulder. And what we can do for the shoulder is just taking your hands up and pulling it up as much as we can. Pull it up. Both the hands up. Pull it up as much as you can. Then as we yawn, a yawning circle with a very slow speed. Take your hands back. See, like that. And coming forward. Wait it. Like this. Like this. And come. Just as we yawn. Very slowly go back. Once you go back, you will feel a stretch. Hold it over here. And then slowly, slowly come back. Even in this, you can add breathing. Inhale while going up. Remember it, up is inhale, up is God. Inhale towards God, exhale towards up. Okay, inhale, take it up. Because in this position, our chest is expanding. So we have to inhale up. And while we go down, our chest wall cavity is reducing in size. So we exhale, exhale, and come back to normal. Even doing it for one time, do you feel some relaxation? So we can see she is feeling better with this. If you go only one time also, but in a right way, it will give you result. Secondly, then we come to our chest muscle. Many times we are working forward and our chest is going into the bending position. To prevent that, you need to do some pectoral stretching, the chest stretches. The chest stretches can be done over here, just going in near the wall, taking your hand, one hand back, back towards opposite side to the shoulder, and then moving your neck on the opposite side. Can you feel it on the chest? This side? Yes. Yes, ma'am. Just holding it for 10 seconds because I've already told you for any exercise, if you make a hold, then it will work better. If you do it slowly, it will work better. Okay? So, and then you relax. This is for the chest muscle. Then we fastly go to the wrist. Wrist, we can go for circle of the wrist. Again, remember not to do fast circles. Always do slow. And many times people are told to press the ball. It's a very wrong practice, most commonly used, because all the time we are writing. All the time we are always doing this motion mode. Okay, so we need to do is extension rather than flexion. Many times people are giving balls to do pressing. It's you always observe yourself that we are writing, we are moving all the time bending. So why more bending? We need to do opening. That is really important. This is misconception of people. And next we go to spine, upper spine. Upper spine I've already demonstrated like this. Hands, both hands up and rotating. Once in the left direction, once in the right direction. This can also be done in the office chair. And then to go for the lower spine, if you are sitting, then rotatable chairs are there. We can go for both the legs towards one side and then going on the opposite side. That is for the lower spine. Even trunk rotation is a good exercise, which is commonly done for the low back pain. And back of the thigh. If you can have a chair. You have a stretch for the back of the thigh. We can just go for a foot rest and try to touch the foot. Just a little. Don't touch the foot, but keep it a little bit up. Because if you touch the foot, your neck back bending will be there. But if you go just above the foot also, you will feel the stretch at the back of the thigh. Like this. Okay? And this kind of stretching can be done at the desk. And then we come to the hip joint. Hip circles can be done. Hip sitting, sit stand can be done. Like stand up and sit down. It's the hip activity. You can go for circles of the hip, standing over here. We can go for the calf stretches. Any kind of up, like if you go for this, if any, I'm basically keeping my foot up, toes up, heel down, and I'm just moving forward. It will give you the calf stretch. This is the back of the leg. This is a very easy stretch which can be done anywhere, any place. If you're standing for a long time, you're going for a stair climbing in the offices, one should practice this. And then for the numbness, if any kind of numbness is there, foot exercise can be done similar way. The wrist can move circles. And if you go for any numbness, if you're having numbness at the legs, then you have to just take your foot up and down. If you are doing up and down foot, at one angle, you will feel numbness is again coming up. The angle you have to choose by your own. Like you can take your leg left or right, anywhere, in and out. In any position, you just try up and down. Take your foot up and then down. If you are having numbness in the leg, in any one of the position, you will find again numbness coming up, on and off, on and off. You just have to do that on-off effect. That on-off effect only will stretch the nerves and the numbness will reduce. Even in the arms, many people have the numbness. Then again, just in this position, take it up and down, up and down. If the person is having numbness in any one of the angles, he will again have the numbness. Just have to take on and off, on and off. This will reduce the numbness. This kind of the exercises are very easy to do exercises. It will just take 10 to 15 minutes to do, and we can save our life, elongate our life in a functional way. Thank you so much.
So, if a person is having back pain and no solution is there, he doesn't have any doctor nearby, this is the position in which if you lie down for 15 minutes, the pain reduces. The back pain is really reduced in this position. This position is called 90-90 position. So, it is a home remedy for you all. Okay, so these are the wedges which are used to correct the posture. I told you about this. If you keep the knee bending, your back will never bend. So you can keep any pillow, round pillows are available in India for longer duration. We all had it in our home. If you keep any pillow under the knee, your back will not bend and the capability to sit will increase. The research data is available on this. So I hope you will prevent your posture to go into the wrong side. Okay, just go in the good postures to maintain your life and become more functional. Otherwise, we might develop these different kinds of common deformities. One is humpback, like this. In this, I have explained much of this. Upper cross syndrome is available like in humpback. And in flat back can develop straight spine. Bamboo spine is common. Ankylosing spondylitis. And sway back postures are available. Abdominal tummy. I showed you after a baby delivery, mostly people have this abdominal tummy. Sway back postures. Scoliotic postures, when your spine goes into the tilting. One side tilt is there, one shoulder up, one shoulder down. Even if you observe a client properly, the arm and the body distance, this distance will definitely be changed. One side will be more, one side it will be less, because your center of gravity changes, balance loss is there, and these kind of abnormalities can be developed. And if you find yourself into this kind of postures, then you must visit a physiotherapist for a good result. If a person bends in the scoliotic spine, always one side is up, one side is down, he's also having a ribs deformity, and breathlessness is there on walking along or stair climbing. Person is feeling breathlessness. If breathlessness is also there, one must go to a chest physiotherapist to know more about it. How to take care of postures? I hope you will do. All of you will do it.
Yes.
Few of the exercises: yoga, Pilates, strengthening of your abdominal core muscles. Core muscle strengthening, the best way is to do it with a Swiss ball. That's kind of Swiss ball is available. You can see over there. Just sitting on it for 15 minutes. Just see your balance, standing on one leg, and you sit on this ball for 15 minutes. You will gain more balance. How this happens? Because if we go into the imbalance, our balancing muscles get activated, and into my practice I have observed even the paralytic patients are started to walking within first week of their physiotherapy. How this happens is we go for Pilates exercise, abdominal core strengthening, and the Swiss ball activities. So I hope you like this webinar, and thank you so much for being a part. Thank you.
Ma'am, one question. Is it advisable to wear heels every day?
Uh,
Ma'am, one question. Is it advisable to wear heels every day?
See, wearing heels is not a problem. The problem is not exercising. अगर हमें if we are having any pains in our body, people say many or it's very common. People say don't go for stair climbing, don't go for bending. But if we are having a problem while breathing, will anyone say that don't go for breathing? Tell me. Nobody would say that because if we don't breathe, our life is not there. So in our work style is important. Like we have to work on the computer job, we have to do all kind of stuff. But we can do. Wearing heels is not a problem. Not doing the exercise to correct it is a problem. If you are doing those exercises, you can go for any kind of pencil heels. All the actresses do that, isn't it? Any more questions?
It's very great privilege to have you over here.
Thank you.
Actually, my good self, I want to tell the audience, mostly female students are sitting over here. As you told that the knockness problem is very common among them, wearing the footwear and because of the the walking patterns. What would you like to suggest for them? Because most of the majority of the students are
Yes,
female.
knock knees is really common because we have a habit of sitting cross-legged, one leg on the other. We join our legs too much while all the time when we are standing also, when we are sitting also. Our legs need distance in between. I'll show you the one demonstration. See to it. If our hips, our knee should come under the hip joint. Just see. If this is my hip joint, my knee should be underneath. Okay? But if we go for a cross leg or joint legs or like this, then it's not underneath. Okay? This distance is required.
Why?
Hello?
Yes, the distance is required. The hip knee joint should be underneath your hip joint. That is why I told you while lying on your side, you should take a pillow in between the legs. This is a very common thing, and the ladies should not feel that. The women should not feel that I am down to somebody. We are always crossing our legs, sitting closed, hunched. You should be confident enough that you can do anything. Your shoulders should be broad, your knees should be apart, and you should be equal to the men. Okay. Anything more?
Hello?
Yes.
Ma'am, I'm having my right shoulder, frozen shoulder since the last 1 year.
Okay.
So I'm doing leg exercises, but I don't know which is the best exercise for me. So can you suggest me some exercises?
See, for frozen shoulder, there are plenty of exercises, but each person is different. Okay. Properly assessment is really needed to give you the exercise plan according to you. I can tell you the general exercises. General exercise people are doing that, going on the walk, going for the circles. But again, it should be specific. Many times, if you keep one hand on your chest, one hand on your abdomen, just feel your breath. One hand on your abdomen, one hand on the chest. Like this. Like this. Just breathe in the position with one hand on the chest, one hand on the abdomen, and feel your breath. Is your breathing is through your chest or through your abdomen? Just feel for few seconds. Okay, feel for few seconds. Inhale, big inhalation and big exhalation. Is your chest moving all the time, or one thing is moving, or both the things are moving? Both are moving. See, if the breathing is correct, then the reason is different. But mainly serratus anterior muscle gets weak. The trigger points are also developed many times. We have to correct those trigger points. Dry needling is a very good therapy for the shoulder pain. And once physiotherapists have made some corrections of your shoulder, then your exercises will give you much more results. If only exercise we are following at home, sometimes it takes months. But if you go for a proper physio, for even we have results within 3 days. If you go for 3 days of proper physiotherapy, we are releasing all those muscles which are getting shortened up, and then you are told to go for some strengthening exercises that will give you good results. But easily you can do some rhomboid strengthening, that is your upper back strengthening, by pulling something like this. Okay, pulling, holding for some time, and doing some circles, and again circles in the same way which I told you. Slow circles with breathing.
Thank you. Ma'am, one question from my side, because I have seen you are working on the cardiopulmonary, right? So nowadays, pulmonary hypertension is the major research area and thrust area throughout the world as compared to the hypertension. So in the case of the pulmonary hypertension, which exercise which you suggested which directly acting on the pulmonary hypertension?
Pulmonary hypertension, again, we need to check the posture, because I have seen with the posture also there is a pulmonary pressure increasing. The hypoxia is being created once you develop a kyphotic posture, and that hypoxia is leading to more respiratory rate and detoxification, like our endorphin and enkephalins are not being properly produced in our blood. We are having pains, we are developing due to pain also we are developing more heart rate, and we are developing the hypoxia and leading to the hypertension later on. But simplest way I would tell you in the simple terms that we need to do some breathing exercise, especially your lateral costal breathing. If you keep your hands over here, inhale, expand your chest, and then hold it for a few seconds, and then exhale. You have to feel your lungs moving. I will just show you one demonstration for this. Can you give me a mic?
Actually, ma'am, that is directly acting. You are saying that endothelial drive relaxing factor. That is a major part playing a role in this case.
See, we need to just see to it, even as, with the stethoscope also, which area of the lung is moving or not moving. But diaphragmatic breathing is also good. Like you have to see the breathing pattern of the person, whether he is having what kind of posture he is having, what kind of breathing he is having. We have some techniques to release the diaphragm also. Diaphragm release technique for the after just doing that diaphragm release technique also, your diaphragm is moving more. There are many physiotherapy techniques for this, but the person normally what we can do is just go for a proper breathing pattern. Once you keep your hand laterally and inhale and exhale. Inhale and exhale in the lateral direction. Then you keep it in the front. Inhale and exhale. And you can even add movement into it. Inhale, go back. Exhale, go forward. And you can keep your hands over here. Inhale and exhale. Many times you will feel that this area, upper lung area, is not properly moving. But with practice, it will move more. You will find more movement, and even the hypoxia reduces, and later on the hypertension is also better.
Yes, please.
Dr. Gupta, Dr. Gupta, actually, I want to add something with the ma'am's demonstration. Your question, what you asked, is very good. That pulmonary hypertension these days is very. As ma'am said that nowadays, what we are breathing is we are having abdominothoracic breathing. We don't have the thoracoabdominal breathing, and at the time we get more expansion towards our chest. We stretch our pectorals, And roll of the diaphragm also. The descent of the diaphragm increases the intra-abdominal pressure, and that is the passive phenomena that leads to the expiration. So once we control the oxygen carrying capacity of our blood, and when we inhale and the chest gets expanded, you can rule out the pulmonary hypertension. Loud means.
That I understand, because there's a tidal volume that is a major restriction in this case, because in the pharmacological views point there is a lot of the controversial in this case. So that's why this physiotherapy may be act as a primary.
In my video, I have already sent a video over here. In that video, we have even researched in our clinic for diaphragm release techniques. And after doing the diaphragm release techniques and the breathing exercises, we have even changed the chest expansion in inches. There is a change in the 1.5 inch change is also observed within a few days of physiotherapy for the lungs. So, being a cardiopulmonary physiotherapist, I'm adding up many of the cardio things into the daily practice as well. Yes.
Ma'am, I have a question. So when we are physiotherapists, we know the exercises, but ma'am, what exercises or what random remedies you would suggest for low back pain? Because this problem is very common these days, low back pain.
Few core stability exercises you can demonstrate to the audience.
Just few random
See, one thing for core which is really important for the core strength. Many times we are ignoring our core muscles. When we go to a physio, also sometimes physios are also mainly stressing on the back. But have you see all the organs also have the nerve supply from the lumbar area. Okay, so lumbar area is unstable if your abdominals are unstable. First of all, just check your balance. Stand on one leg. If your balance is not good, you need to strengthen up your core. If you cannot stand on one leg for a longer duration, if you cannot bath while standing, if you cannot change your pants in standing, you need to go for some core strengthening. Why we go up for core strengthening after back pains? Why not at the initial stages? We know that our core is getting weak enough. And core muscles are really important. And I will show you a result. Okay, well, just any one of you just come with a Swiss ball. Swiss ball is something which is giving you core strength very fast. Any three people? Any three of take your right leg up. See this shaking is there in her and her foot also. Can you see this shaking? Both the legs are shaking. Can you feel this? Yes, sir. Okay. While they are doing one leg standing, her leg is also shaking. That leg is also shaking. Yes. Hello? Yes. Can you see the left leg shaking? These two girls are having less core strength. Okay, this is the simplest test to check that your core is getting weak. And if your core will be weak, any light trauma or any light stress will give you back pains. Okay, down and do it on the other side. Left leg up. See the shaking? See the shaking over here. Can you all see that? Too much of shaking. Okay. Now I will demonstrate for one of you. Any one of you?
Yes.
Any one of you. Just come and sit over here. Now what this ball is doing is, this is giving you an imbalance. Go back, more back. Hands up. This is the simplest exercise, or we can do for every one of us go for eating, isn't it? You can sit on the ball and eat. Jump on the ball. Jump. This jumping on the ball is also giving you core strength. Can you feel your abdomen working? Yes, no. Now, in the same position, just go for left and right.
This ball is really very easy to take. It's available in the Amazon. No, very easy to get, and it's not with that harshly costing as well. This is also core muscles, and go for a knee up and down. One knee up and down. Okay. Take one knee up and down. Do it 5 times. This is also core for the lower abdomen. Okay. Now come and stand up. Stand on one leg. The same leg. Can you feel the shaking is reduced? Yes. With this, if you this was a demonstration of few minutes, but if person is doing it regularly, definitely within 2 to 3 days I have seen the changes. Within 3 days of physiotherapy on the Swiss ball. Because being a Pilates instructor, I have been practicing this all kind of pilot exercises, and this is one of them. It will give you such core strength that you will observe that the person who is not able to walk, even nowadays also we are having a person, a 77-year-old lady, I was just talking with ma'am in the morning. 77 years lady, she wasn't able to walk. Two people brought them carrying into my clinic, and we go for the pilots, this kind of exercises, and within the third day there is a video also. The person is walking on her own. So it is possible within days. Doesn't take months nowadays. Now, if you want it in the lying position, just lie down. If you want a very easy to do, no means if you don't have any ball at home, what you can do is see when we are having back pains, we are already weak. We cannot go for crunches. We should not go for crunches rather. Okay, so there are easy to do exercises also available. One can do like this. Hold, hold. Can you feel it on the abdomen? This is one leg holding. This is one leg holding. And when you are comfortable into it, you can go for 2 leg holding. This is also core muscles. And to make you more comfortable, you can keep a pillow in between. Hold this pillow. Can you feel it on the abdomen? Position is strengthening up your lower core, and if you want to go for a upper core muscle, then you can do it. Don't lift your neck. Once we are lifting our neck, many of us have neck pains. Okay, so don't lift your neck initially. Once you train your neck first, like chin tucks is a very good exercise for your posture. Like this. It's you're looking at the same point and going back. If you're doing this is the chin tuck. This is also a muscle which is most commonly weak. So chin tuck is a very good exercise for posture care. And for upper abdomen, which I was talking about, just try to lift a little and touch your knee opposite side or on the same side. Both hands together and then down, then up, then down, opposite leg up, down, opposite leg up, down. This is for strengthening. And for your back relaxation, what you can do is taking this one side and the other side and making it more better. Just take your hands up in the diagonal direction, take it up. When you're taking it up, you are increasing the space of breathing also. Breathing is also increased, that is, and then you are taking it left and right. This is also giving very good results for the back pains. Okay? Thank you so much. Anything else? How may I help you? Thank you so much. Okay, thank you so much. Any questions from the audience? If anyone want to ask anything, they can. Thank you so much, ma'am, for such a valuable session. We all will remember there is no medicine to gain range of motion, muscle strength, coordination, balance, good posture, fitness, and only physiotherapists work. Now, as you said in your session that car service is equal to the body service. It's a necessity. So a man too busy to take care of his health is like a mechanic too busy to take care of his
tools. It is the same thing. So now I would like to request, call upon stage VC sir, Registrar sir, Dean of Student Welfare, Dr. Neena ma'am, Head of USMS Department, to come on the stage and present a token of respect to the speaker. So, from this session, we have learned movement is a medicine for creating change in person's physically, emotional, and mental states. That movement brought back by us when you think it will never come back again. We are not just doctors, we are physiotherapists. Now, I welcome our head of department to give a vote of thanks to the speaker.
A very good afternoon to every one of you. It is my privilege to propose a vote of thanks. I, Dr. Shaina Verma, Head of Department, Medical and Allied School, on behalf of entire fraternity, first of all, thanks Almighty to make this event a resounding success. A special mention to the Vice Chancellor, Sir, for being a catalyst that stimulated us to do our best every time. A very, very, very big thanks to Speaker of the Day, ma'am. You have enlightened our mind as well as our posture too. Finally, I would like to thank our students, deans, heads, our viewers, especially the online viewers who are watching this live, for joining us. And we really want you guys and to know about, especially the students, to know about your good postures, and especially to the mentors also who are teaching online these days. And I will not say much, but at the end, I would say before you take, if you have pain and if you take and you decide to keep a pill on your tongue, just remember we are physiotherapists and we can treat you without medicine, because physiotherapy don't add years to life, but a physiotherapist and his physiotherapy techniques add life to years. Thank you so much once again, everyone.
Thank you so much everyone for joining us